Hello, welcome to my channel. So today we are now going to talk about body fluid compartments. So specifically, we'll continue with human anatomy and physiology, but specifically we'll concentrate on the body fluid compartments. Okay, so let's start with an introduction about the body as an organized solution. Okay, so you know that cells exist in an internal sea of extracellular fluid enclosed within the integument of the animal. Okay, enclosed with then from the extracellular, the cells take up O2, which is oxygen and nutrients, and discharges metabolic waste products. Okay, then the extracellular fluid is divided into interstitial fluid, plasma, blood plasma, and lymph. Okay, then what you need to know is that there are some terminologies which you need to put in place, so which you have to know. Extracellular fluid, as we have discussed, it is the body fluid outside the cells, and it is the internal environment of all multicellular animals. Then intracellular fluid, which is ICF, which is the cytosol, also known as the intracellular fluid or cytoplasmic matrix, is the liquid found inside cells, and it is separated in two compartments by membranes. Then the interstitial fluid, which is the fluid which is neither extracellular fluid or intracellular fluid. That is the fluid found in the intercellular spaces. Okay, so these terminologies are supposed to be known and integrated in your language as you are learning the anatomy and physiology. So this is the physiology part. So this language has to be integrated into physiological uh, dictionary. Okay, so we can now move on. Okay, so you know that plasma is just the yellowish liquid component of blood that normally holds the blood cells in the whole blood in suspension. Then, in other words, it is the liquid part of the blood that carries cells and proteins throughout the body. Then it also makes up 55% of the body's total blood volume. Okay, then lymph is the fluid that flows through vessels and nodes of the lymphatic system. Then it is formed when the interstitial fluid is collected through lymph capillaries. Okay, so this is what we are talking about. These are the body fluid compartments. We have plasma, which contains about 3 liters. Then, of course, we have capillary membrane, which connects the plasma and the interstitial fluid, which contains about 11 liters. Then we have the cell membrane, which now connects the interstitial fluid with the intracellular fluid. Okay, then outside, meaning this part, specifically this part. Okay, so between the interstitial and the plasma, there is another fluid outside, which is the extracellular fluid, which contains about 14 liters. Then, when someone takes in fluids, they go into plasma, or they become some components of plasma, and they are excreted by kidneys, lungs, feces, sweat, or skin. So this is the summary of body fluid regulation, including the major fluid compartments. Okay. Then, in terms of calculations that you need to know, so the total body water, in a 70 kg man. So we are using a constant or a standard weight, which is a 70 kg man, as about 42 liters of the total body water. Then now to calculate that, we did total body water is equal to 0.6 multiplied by body weight. Okay, so if our man is 70 kg, we have 42 liters. Then in this same 42 liters, the intracellular fluid, the intracellular fluid, contains 2/3 of the total body weight, which is equal to 28 liters. So 2/3 of the total fluid, total body water, is of the intracellular fluid. Then the other 1/3 is of the extracellular fluid. So specifically, from a 70 kg man, or who has 42 liters of total body water, so it's equal to 14 liters. Then this extracellular fluid again, it has its own components. So we are going to start with a transcellular fluid, which contains about 0.5 liters. Then the plasma contains 1/4 of the extracellular fluid, which is the 3 liters. Then the remaining 3/4, which is the 3/4 of the extracellular fluid, is interstitial fluid and contains about 10.5 liters. Okay, so these are the charts for the daily intake and output of water in mils per day. So fluid ingested, let's say the normal, you should ingest about 2100 mils per day. Okay, then from metabolism about 200, which is the normal. Okay, then on heavy or exercise still remains 200. But for the fluid ingested, if on prolonged or heavy exercise, it doesn't matter as long as you have at least gone above the normal and as much as you can tolerate. But from metabolism still remains constant. And the total intake together is just 2100 plus 200, which is 2300. Then if someone is in prolonged or heavy exercise, still it's unknown, since the from metabolism is constant, but from the fluid ingested it's not constant. Okay, at least as long as we exceed the normal and add what you can tolerate. Then the output, so output we can have from insensible loss, which is from the skin, which is constant at 350 mils per day, and even on prolonged exercise is still 350 mils per day. Then insensible from the lungs, also 350 mils per day. Then on prolonged heavy exercise, it goes up to 650 mils per day. Then from sweat, it's 100 mils per day or normally. Then if on prolonged heavy exercise, it's 5000 mils per day. Then from feces, it's 100 mils. Then again, on prolonged heavy exercise, it still remains 100. Then urine excretion, if on a normal day, is 1400, but on prolonged or heavy exercise, the urine excretion about 500 mils per day. Then the total output is 2300, and the on heavy or prolonged exercise, it's 6600. This is the daily intake and output of water that you are supposed to actually take into consideration. Okay, so how do we measure various body fluid compartments? Okay, so for total body water, where we have 2H2O and 2H2O and pyrene, that's what you can use as indicators. Then for extracellular fluid, other indicators we can use is sodium. You can use iothoramite. Then you can use thiosulfate and inulin. These are indicators we can use. Then for intracellular fluid, you can use which is calculated as total. So the intracellular fluid is calculated as total body water minus the extracellular fluid. Okay, so meaning the intracellular fluid ICF is equal to the TB, total body water, minus the ECF. Okay, hope you can see. So that's the intracellular fluid. Okay, then the plasma volume can use 125 as albumin. Then you can also use Evans blue dye. Okay, then for blood volume, you can use 51 CR labeled red blood cells, or calculated as blood volume is equal to plasma, then everything divided by 1 minus hematocrit. Then for interstitial fluid, we can calculate as extracellular fluid volume minus the plasma volume for you to find the interstitial fluid. That's how we measure the various body fluid compartments. Hope we are together on this one. Okay. Then for indicator solution principle supposed to be used in measurements of the body fluid compartments. So the volume of a fluid compartment in the body can be measured by placing an indicator substance in the compartment, allowing it to dispense evenly throughout the compartment's fluid, and then analyzing the extent to which the substance becomes diluted. So this method is based on the conversion of mass principle, which means that the total mass of a substance after dispersion in the fluid compartment will be the same as the mass as the total mass injected into the compartment. Okay, then this is the dilution principle. So the indicator mass A will be equal to volume A multiplied by the concentration A. Then the indicator mass A should be equal to indicator mass B. Okay, then indicator mass B again will be equal to volume B multiplied by concentration B. Then volume B will be, this is volume B, so volume B will be equal to indicator mass B divided by the concentration of the same B. Hope we are together on the dilution principle. Okay, so hope we can now move on. Okay, so this is the dilution principle. Okay, then a sample of fluid containing the dispensed substance is removed, and the concentration is analyzed chemically, then photoelectrically, or by other means. Then if none of the substance leaks out of the compartment, the total mass of substance in the compartment, which is volume B, multiplied by the concentration B, will equal the total mass of the substance injected, which is the volume A, multiplied by the concentration A. Okay, then by simple rearrangement of equation, one calculates the unknown volume of chamber B as volume B will be equal to volume A multiplied by concentration A, then divide everything by concentration B. That's the formula to calculate the unknown volume. Okay, an example. So this is an example which we have to solve. So if 1 milliliter of a solution containing 10 milligrams per ml of dye is dispensed into the chamber B, and the final concentration in the chamber is 0.01 milligram for each millimeter of fluid, what is the unknown volume of the chamber? So if 1 milliliter of a solution containing 10 milligrams per ml of dye is dispensed into the chamber B, and the final concentration in the chamber is 0.01 milligrams for each milliliter of fluid, what is the unknown volume of the chamber? Okay, so answer is from the formula we said volume B will be equal to if we subtract, or if we substitute everything we had learnt from the formula which said how to calculate volume B, we use the concentration of volume A, the amount of volume A multiplied by concentration of A, then we divide everything by volume B. So after we substitute that, we're going to have 1 ml, which is the solution of volume A. Then the concentration of volume A is 10 milligrams per ml divided by the concentration of volume B. Then the answer will be 1000 ml. That's the unknown volume. Okay, hope we are together on this one as we proceed. Okay, then this method can be used to measure the volume of virtually any compartment in the body, as long as the indicator dispenses evenly throughout the compartment. Then, as long as the indicator dispenses only in the compartment that is being measured. Also, as long as the indicator is not metabolized or excreted. If the indicator is metabolized or excreted, the correction must be made for loss of the indicator from the body. Okay, so how do you measure total body water, extracellular fluid, intracellular fluid, plasma volume, intracellular fluid, and interstitial volume? So let's start with measurement of total body water. So we can use radioactive water, which is tritium, which is 3H2O, or heavy metals such as deuterium, which is 2H2O, which can be used to measure the total body water. Okay, then these forms of water mix with the total body water within a few hours after being injected into the blood, and the dilution principle can be used to calculate the total body water. Okay, then another substance that has been used to measure the total body water is antipyrine, which is a very soluble, which is a very lipid soluble and can rapidly penetrate cell membranes and distribute itself uniformly throughout the intracellular and extracellular compartments. That is antipyrine. Okay, then how do we measure the extracellular fluid? So measurement of extracellular fluid can be estimated using any of several substances that dispense in the plasma and interstitial fluid but do not readily permeate the cell membrane. So they include, of course, the radioactive sodium, radioactive chloride, radioactive iotharamite, and thiosulfate, iron, and inulin. Okay. Then, so when any one of these substances is injected into the blood, it usually dispenses almost completely throughout the extracellular fluid within 30 to 60 minutes. So then how do you calculate intracellular fluid? So calculation of intracellular fluid. So the intracellular fluid volume cannot be measured directly. However, it can be calculated as intracellular fluid will be equal to the total body water subtracted by the extracellular fluid volume. Okay. Then for measurement of the plasma volume, so to measure the plasma volume, a substance must be used that does not readily permeate capillary membranes but remains in the vascular system after injection. So one of the most commonly used substances for measuring plasma volume is 1. The serum albumin labeled with radioactive iodine. So 125 iodine albumin. 125 labeled albumin, labeled iodine albumin, or serum albumin labeled with radioactive iodine. So serum albumin with labeled with radioactive iodine. That's one. Then 2, we can use Evans blue dye, also called T1824, that avidly bind to the plasma proteins. Okay, then how do we calculate the interstitial fluid volume? So interstitial fluid volume cannot be measured directly, but it can be calculated, of course, as follows. So interstitial fluid will be equal to the extracellular fluid minus the plasma volume. Then for measurement of the blood volume, so if one measures the plasma volume using the method described earlier, the blood volume can also be calculated if one knows the hematocrit, which is the fraction of the total blood volume composed of cells. So using the following equation, we are now going to show. So the total blood volume will be equal to the plasma volume divided by 1 minus hematocrit, which is a fraction of the total blood volume composed of cells. That's how you measure the total blood volume. Okay. So another way to measure the blood volume is to inject into the circulation red blood cells that have been labeled with radioactive material. Then after this mix with the circulation, the radioactivity of a mixed blood sample can be measured, and the total blood volume can be calculated using the indicator-dilution principle. Okay, so a substance frequently used to label the red blood cells is the radioactive chromium, which is 51 chromium, which binds tightly with the red blood cells. Okay, then how do you determine the body fat? So determining the body fat, there is a technique called the bioelectric impedance technique, and it has the principle of one. So it has many principles, but one principle is that the body fluid conduct electricity well. Then but the fat is an hydrous and therefore is a poor conductor of electricity. Then the resistance to flow of a small current between points on the body is proportional to fat mass. So these are the principles when determining the body fat. Okay. Then for the lean body mass, which is the lean body mass is fat-free mass, is the total body mass, which is equal to fat mass plus fat-free mass. So that total body, the formula for the total body mass, fat mass plus fat-free mass. So you have to note that fat is relatively anhydrous. So the other thing is the H2O content of the lean body mass is constant, and the H2O content of the lean body mass is constant, which is about 70 ml per 100 grams tissue. Okay. Then there are some things which may cause inappropriate compartmentalization of the body fluids, and these things, if they were to lead into those inappropriate compartmentalization, it might result in edema. Okay, so we have clinically under internal medicine and other courses such as pediatrics, even surgery, and even obs and gyn. So the edema is one of the common presentations among patients, especially in internal medicine. So we have to know the causes and pathogenesis of edema. So basic causes of edema, we have one, imbalance of exchange between the intravascular and the extravascular fluid, which is due to maybe retention of water and sodium in the interstitial space. Then the other could be retention of fluid in the body, which could be due to an imbalance between the intra and extra body fluid. These are some of the causes. Okay. Then you also have to know other things which might cause extravasation of fluid. So number one would be due to an increased capillary hydrostatic pressure. Examples would be due to arterial dilatation, venous constriction, increased venous pressure, heart failure, and extracellular fluid volume expansion. Then the other cause, so this is number one cause to extravasation of fluid. Then the other cause could be due to decreased capillary oncotic pressure. So what are we talking about exactly? So if you have decreased plasma protein, number one culprit is albumin. If albumin starts decreasing, it's also going to decrease the capillary oncotic pressure. Okay, so decreased plasma protein concentration. Then the other thing is severe liver failure, which leads to failure to synthesize protein, again albumin, protein malnutrition, nephrotic syndrome, which leads to loss of protein in urine. So in short, in nephrotic syndrome, there is what we call hypoalbuminemia, which is low albumin again. Okay. Then the other cause would be due to an increase in hydraulic conductance due to in burns, or in cases of inflammation where there is release of histamines and as well as cytokines. And again, even in burns, one of the inflammatory mediators or one of the responses is to initiate inflammatory cascade, where again the inflammatory mediators such as histamine, cytokines are also released, and that's how again burns inflammation will lead to extravasation of fluid. Then the other cause would be due to impaired lymphatic drainage, for instance standing due to lack of skeletal muscle compression of the lymphatics. The other cause would be due to removal or irradiation of lymph nodes. The other cause would be due to parasitic infection of lymph nodes. Okay, so these are some of the causes of extravasation of fluid may lead to edema and other things such as ascites and whatnot. Okay, so this is the capillary filtration force. Okay, an illustration. So the capillary, which is a fluid where there is fluid movement by an innate pressure in the capillaries, and the cell where there is fluid movement by osmosis. Okay, then intracellular osmotic pressure inside the cells and the interstitial osmotic pressure outside the cells. Then filtration will be taking place outside the cells, outside the arteries of the capillary, due to capillary hydrostatic pressure will be going out of the cells, and inside the cell what will be bringing fluid inside the artery of the capillaries and as well as venues will be due to reabsorption due to capillary oncotic pressure. Okay, even in lymphatics which will be due to interstitial hydrostatic pressure. So these are the capillary filtration forces, how the movement of fluid by net filtration and of course by osmosis as well. Okay, so example we can give from the what we learned about the lean body mass and the fat mass is in a healthy adult male weighing 70 kg, the total body water was measured to be 42 liters. What is his lean body mass? And of course, what is his fat mass as well? So, given the total body water of 42 liters, you have to assume all this water is in the lean body mass, and that fat is water free. Then we all know that the water content of lean body mass is 70 ml per 100 grams. So thus, if the total body water is 42 liters, then the lean body mass will be equal to 60 kgs. So since he weighs 70 kg, his fat mass is going to be 70 minus 10, which is going to be 10 kgs. Hope we have followed what we have gone through. Let me just repeat. So given that this person's total body water is 42 liters, then of course you have to assume that all water in the lean body mass and that fat is water free. Okay, then we know that the water content of the lean body mass is 70 ml per 100 grams. So for someone who is having the total body water 42 liters, their lean body mass will be 60 kgs. Okay, hope we are now together on this point. So now, since this person weighs 70 kg, his fat mass will be 70 minus 60, which is equal to 10 grams, 10 kg, which is kilograms. Okay, so let's continue after following this example. So you need to know the units for body fluid composition. Okay, so this is going to be an introduction on the same. So the physiological solutions are frequently expressed in moles, equivalents, or osmos. Then mole is the gram molecular weight of a substance, that is molecular weight of the substance in grams. Okay, then equivalent is 1 mole of an ionized substance divided by its valency. Then osmo, which is abbreviated as OSM or osmo, is a non-SI unit of measurement that defines the number of moles of solutes that contribute to the osmotic pressure of a solution. So the term comes from the phenomenon of osmosis and is typically used for osmotically active solution. Okay. So for other units, so for molarity, we can have mole per 1 liter solution. Then molarity is now for mole per 1 kg solvent. Then for osmolarity, you can have osmos per 1 liter of solution. Then for osmolarity, you can have osmos per 1 kg solvent. Okay, so example, what is the molarity of a solution consisting of 11.8 grams of sodium oxide dissolved in enough water to make 300 ml of a solution. Okay, what is the molarity of a solution consisting of 11.8 grams of sodium oxide dissolved in enough water to make 300 ml of solution? Okay, then other examples where we have another example will be 630 grams of nitric acid and HNO3 are added to 6.5 kg of water. Calculate the molarity of this solution. Okay, so those are examples which you have to go through, and these are the table for the osmolar substance in extracellular and intracellular fluids. So for sodium, the plasma milliosmolarity per liter H2O is 142. Then for interstitial is 139. Then for intracellular is 14. Okay, but we are not going to go through everything. Just you can pause and you go through the osmolar substance in extracellular and intracellular fluids. Okay, so this is the table for you to just go through and remember this information, at least for sodium, potassium, calcium, magnesium, and chloride, even bicarbonate. Okay, so I think we can now move on, even for glucose, of course, and protein, urea, and these are especially for this, and creatinine as well. Okay, so we can now move on for water, electrolytes, and acid base. So this is also another set of information which you also need to take into consideration. So you all know that water is an excellent biological fluid that serves as a solvent. Then electrolytes, such as sodium chloride, are molecules that dissociate in water to their cation, which is sodium, sodium plus, and an ion, which is chloride, and that's the negative. Okay, so to show you that sodium is positively charged, then chloride is negatively charged. That's why it's called an ion. Okay, then since sodium is positively charged, it's being called cation. Okay, so these are equivalents. So physiologically important electrolytes, yes, we have sodium, potassium, calcium, magnesium, chloride, and bicarbonate. Okay, then electrolytes and other charged compounds, for instance, proteins, are unevenly distributed in the body fluids. So this separation plays an important role in physiology. Okay, so the solutes that are broadly classified, the solutes that we have are broadly classified into electrolytes, which are inorganic salts, where we have all acids and bases and some proteins. The non-electrolytes, which we have, will include glucose, lipids, creatinine, and urea. So electrolytes, of course, have greater osmotic power than non-electrolytes. So then water moves according to osmotic gradients. Then talking about the same important the same electrolytes that we have mentioned, now their importance. So we now talk about their importance of the electrolytes that we have talked about. So starting with sodium ions. So sodium ions, of course, this is a mineral that's essential for life, and it's regulated in the body by your kidneys, and it helps control your body fluids balance. It also helps send nerve impulses and affect muscle function. Having less sodium in your diet may help you lower or avoid high blood pressure. Then for potassium ions, of course, this is one of the most important minerals in the body. It helps regulate body balance, muscle contractions, and nerve signals. Then what's more, a higher potassium diet may help reduce blood pressure and water retention, also protects against stroke and also prevent osteoporosis and kidney stones. Okay. Then also the other thing which was not mentioned, of course, that's also a helper. Even there is the potassium. Potassium also helps insulin to go inside the cells. Also, that's also one of the potassium is helped by insulin to go inside the cells. So these are other things that you also have to know about the ions, that they are helped by the what we call the pumps, okay, which we talked about during the previous lecture. So they are what we call pumps. So potassium, there is a potassium hydrogen pump, okay, or the sodium hydrogen pump. So an example which helps push potassium inside the cells would be insulin in this case. That was the point I wanted to raise. Okay, then for calcium ions, but of course calcium is actively responsible for a lot of things in your body. So proper amount of calcium help keep your joints free of inflammation and arthritis, as well as help your muscles contract. Then for magnesium ions, these are needed for more than 300 biochemical reactions in the body. Then it helps to maintain normal nerve and muscle function. Also supports a healthy immune system and keeps the heartbeat steady. And also helps bones remain strong. Then it also helps regulate blood glucose levels and aid in the production of energy and protein. Then for chloride ions, they help keep the amount of fluid inside and outside of your cells in balance, and it also helps maintain proper blood volume, blood pressure, and pH of your body fluids. Also tests for sodium, potassium, and bicarbonate are usually done at the same time as blood test for chloride. Then for bicarbonate ions, these are the primary role for bicarbonate ion in the blood system is to transport waste carbon dioxide from the various body tissues to the lungs, where it can be expelled. Okay, so these are the non-electrolytes and electrolytes components of blood plasma, interstitial fluid, and extracellular fluid. You can pause and even go through. Okay, then you also have to know about pH and buffering. So pH of a solution is defined as the logarithm to the base 10 of the reciprocal of hydrogen concentration. That's the pH of a solution. So it's defined as the logarithm to the base 10 of the reciprocal of hydrogen ion concentration. So in plasma of a healthy individual, pH range from 7.35 to 7.45. So the body pH is stabilized by buffering capacity of the body fluids. So we have to know that a buffer is a substance that has the ability to bind or release hydrogen in solution. Okay, so that's the pH scale, where we have if the pH is less than 7.35, we say it's acidic. More than 7.35, that's basic. Okay, the neutral is the 3.35 to, or the normal 7.35 to 7.45 in a healthy individual. Okay, so we can move on. So these are the blood pH. So that's the blood pH. If the normal is 7.35 to 7.45, acidic, this is acidic, this is alkalosis. Okay, then if someone was to have these other ones, then of course the patient will be critically ill, and more likely they will be going into death to meet the ancestors and whatnot. Okay, then for major buffers in the body, we have extracellular fluid. So major buffers in the extracellular fluid are bicarbonate buffer system. Then minor buffers, we can have intracellular protein phosphate buffer. Then in the blood, major buffers we have bicarbonate buffer system, hemoglobin. Then minor buffers, we can have plasma protein phosphate buffer system. Then for intracellular fluid, major buffers, of course, we have proteins, phosphate. For urine, major buffers, we have ammonia and phosphate. And this comes to the end of the tutorial on body fluid compartments. And please make sure you attempt the example that we have given, and also to revise as the terminologies like I explained, intracellular, extracellular, even in as you meet conditions, even as you go ahead, they will be used, so that at least you need to know and understand these terminologies that are used. Okay, so thank you for watching this anatomy and physiology lecture, so specifically the physiological part, and please check out the new playlist, which is the anatomy and physiology playlist, and of course see you on the other tutorial videos, and thank you for watching.